Do you know what tuberculosis is?
I'm not really sure. I know it's something bad.
Do you know what tuberculosis is?
Not really. I've always heard about it.
What do you think that it might be?
I feel like it's something to do with breathing. That's all I know.
Tuberculosis.
Coughing up blood.
What do you think about when you think of tuberculosis?
Lungs.
Alright, what do you think of when you think about tuberculosis?
Like a lung infection.
I'm Whitney. Today we're going to be talking about tuberculosis. We're going to visit Dr. Robert Koch, who found the infectious agents for tuberculosis. Luckily, I have my time machine. Are you okay? You'll get more used to the sensation the more you time travel. Alright, where is he? Over there. I'm Whitney. I time traveled here to see you.
Time travel?
Yes, I currently in a class and I need help learning about tuberculosis, so I thought it would be nice to visit you.
Okay, tuberculosis. I was interested in it after hearing about John Antoine Wilhelm's experiment where he took the tuberculosis matter from a human cadaver and then he put it into a rabbit and then the rabbit died.
Oh my. Wow, that's very interesting.
So I took the tuberculosis material and then I stained it with methylene blue and I saw a circular object, and then in order to get more detail I stained it with Bismarck brown, and then I took that material and cultured it and then put it into a rabbit, and then the rabbit died from tuberculosis. And then I named it tuberculosis bacillus.
All right, that's how we discovered tuberculosis. I have to get back to class now, so.
Hi, I'm here with Dr. Kirkham, and today I'm going to be asking you a few questions about tuberculosis.
Hello, it's very nice to be here today.
Okay, Dr. Kirkham, so I guess how is tuberculosis spread?
You can get tuberculosis by breathing in air droplets from a cough or sneeze of an infected person. This is called primary tuberculosis.
So first I guess I want to ask you, what are the different types of tuberculosis?
Very good question. Tuberculosis is broken up into two different types. There's pulmonary, which affects your lungs primarily. It can also affect your larynx, laryngeal tuberculosis.
Okay.
There's also extrapulmonary. This is normally common with patients who are immunocompromised. The tuberculosis infection, if not treated, can spread to other organs, such as your adrenal glands, pituitary glands, and it can just cause all sorts of problems.
Oh, that's interesting. It's not just in the lungs, which I thought was maybe common.
Yes.
Okay, cool. Okay, so now I guess I want to ask you, how do you diagnose tuberculosis?
Very good question. Normally, we obtain a full medical history of a patient, see if they've had symptoms in the past. That could have been primary tuberculosis. Normally, primary tuberculosis goes away for a while and will stay dormant before it comes back. Then we normally do a full physical exam, including a chest x-ray, see if we can see any sputum that's in the lungs that could be a sign of tuberculosis. But the only definitive way of diagnosing it is by taking a sputum sample or pus or something and cultivating the bacteria, Microbio tuberculosis. So, but that is, the definitive way is to get the culture.
Okay, cool. Hey, Dr. Kirkham, I was wondering if you could tell me how you can prevent TB.
The best way to prevent it is to just, if you know of anybody that has tuberculosis, to of course stay away from them.
Yeah.
If you have to work in an environment where you're near tuberculosis, where face mask, wash your hands anytime. There is a vaccine, BCG or Bacillus Korean vaccine. We don't often use it in the U.S. because it's not as effective. Your risk of getting tuberculosis in the U.S. is very low. And there is a skin test we can use, tuberculin skin test. It's a test if you have TB. But this can give false positive results, and it isn't very effective.
Okay.
So the vaccine can cause problems when diagnosing if you have tuberculosis or not.
Okay, cool. Thank you.
Tuberculosis occurs in every part of the world. In 2011, the largest number of new TB cases occurred in Asia, accounting for 60% of new cases globally. However, sub-Saharan Africa carried the greatest proportion of new cases per population, with over 260 cases per 100,000 population in 2011. Tuberculosis is second only to HIV and AIDS as the greatest killer worldwide due to a single infectious agent. In 2011, 8.7 million people fell ill with TB and 1.4 million people died from TB. Some factors that promote high levels of infection are infection with HIV, tobacco use, and the economic status of a country. TB is a leading killer of people living with HIV, causing 1/4 of all deaths. People living with HIV and infected with TB are 21 to 34 times more likely to develop active TB disease than people without HIV. Tobacco use greatly increases the risk of TB disease and death. More than 20% of TB cases worldwide are attributed to smoking. Over 95% of TB deaths occur in low and middle-income countries.
Treatment for tuberculosis. Tuberculosis disease can be treated by taking several drugs for 6 to 9 months. There are currently 10 drugs approved by the U.S. Food and Drug Administration for treating tuberculosis. Of these approved drugs, there are 4 first-line anti-tuberculosis agents that form the core treatment. These include isoniazid, rifamprin, ethambutol, and pyrazinamide. Regimens for treating tuberculosis disease have an initial phase of 2 months, followed by a choice of several options for the continuation phase of either 4 or 7 months, a total of 6 to 9 months for treatment. It is very important that people who have tuberculosis disease finish the medicine, taking the drugs exactly as prescribed. If they stop taking the drugs too soon, they can become sick again, and if they do not take the drugs correctly, the tuberculosis bacteria that are still alive may become resistant to those drugs. Tuberculosis that is resistant to drugs is harder and more expensive to treat. Resistant tuberculosis is caused by tuberculosis bacteria that are resistant to at least one first-line anti-tuberculosis drug. Multi-drug resistant tuberculosis is resistant to more than one anti-TB drug and at least isoniazid and rifamprin. Treating and curing drug-resistant tuberculosis is complicated. Inappropriate management can have life-threatening results. Drug-resistant tuberculosis should be managed by or in close consultation with an expert in the disease.
Currently, some of the studies taking place involving tuberculosis include vaccine development, antigen identification to enable vaccine advancement, the improvement of diagnostic tests to identify the disease earlier, and inquiries about the genes that are expressed during infection, which could be used in vaccine improvement. Recently, a tuberculosis vaccine developed at Oxford was tested on almost 3,000 babies in South Africa, but unfortunately it did not work in providing protection against the disease. Although modern medicine has stabilized TB incidence in many countries, worldwide numbers of tuberculosis cases continue to grow with the expanding population. Hopefully, funding will continue for research to develop new drugs and new vaccines to overcome the multi-drug resistant tuberculosis, as the number of people facing this disease will only continue to grow.